A rare display of defiance on the streets of China. Protests in Shanghai against Xi Jinping's zero COVID policy and calls for China's president and his ruling party to step down. Video filmed in Shanghai, China's biggest city, shows a heavy police presence and a person escorted away. Other footage circulating on social media shows a BBC journalist restrained by police and arrested. The Asia Director for Human Rights Watch described the scenes as extraordinary in what is the greatest show of public dissent against the ruling Communist Party in decades. Protests spread to other Chinese cities, including Beijing, Xinjiang, Wuhan and Chengdu, reflecting rising public outrage over harsh COVID-19 restrictions and anger over a deadly apartment fire in China's far western Xinjiang region, where at least 10 people died and 9 others were injured on November 24. In a show of solidarity, vigils and protests were held in at least a dozen cities around the world. And hundreds peacefully protested outside the Chinese embassy in London. Some have blamed lockdown restrictions for hampering rescue efforts during the deadly Xinjiang apartment fire, but local authorities have denied the claims. While it has kept China's death toll much lower than those of many other countries, China's strategy of attempting to control the coronavirus with lockdowns, repeated mass testing of millions of people, and lengthy quarantines has meant confinement at home for millions and damage to the world's second biggest economy. Despite using catchy dance tunes to promote an uptake of the coronavirus vaccine and robots to broadcast quarantine advice, more severe techniques have been in place, locking down entire cities and publicly parading residents accused of violating regulations. At an official checkpoint, this team in Henan province, neighbouring Hubei province, which has been at the centre of the outbreak, practised taking down uncooperative victims of COVID in a staged incident. As quarantine restrictions began to loosen in 2020 in hotspot cities like Wuhan, metro lines reopened and barriers at toll gates were removed. But as President Xi's government continues to pursue a policy of zero COVID, it's been a repeat of mass testing. In March this year, more panic buying as supermarket shelves were emptied by shoppers in Shanghai as cases again climbed. A staggered lockdown returned. In April this year, COVID-19 patients were seen lying awake in the early hours across cubicles in Shanghai's main exhibition complex. The landmark building transformed into the city's largest makeshift hospital, holding 15,000 beds. And a new COVID-19 testing lab was completed in Shanghai's Lingang New area with the aim to complete more than 1 million nucleic acid tests per day under a 200-member team. Fruit and vegetables remain difficult to acquire during home confinement. Shanghai residents banged on pots and made noise on the evening of April 28 to ask for supplies. Video verified by Storyful from April 8 shows failed attempts to order fresh food from a local supermarket app in Shanghai's Pudong district.
So?
No.
According to health officials, the city reported 3,200 locally transmitted COVID-19 cases and almost 20,000 local asymptomatic infections on April 15. On the same day in the US, around 10,000 people were hospitalised on average and 1,500 people were in intensive care. By May, there were long lines outside stores in Shanghai as COVID-19 restrictions were eased. And on June 1, residents enjoyed the freedom of Shanghai streets as local officials announced a return to normal after the 2-month lockdown. In September, central Chengdu was deserted, video shows, after Chinese authorities announced a COVID-19 lockdown. And on October 31, security forces in Shanghai were seen again controlling crowds leaving Disneyland after the park was suddenly closed, in line with local COVID pandemic measures. China has had far fewer deaths compared to other large nations and one of the lowest deaths per capita in the world. The official death toll stands at 5,233, the majority during the initial outbreak in early 2020. However, foreign health officials say China's population has very little exposure to the virus, especially the elderly, and is only using domestically developed vaccines, which are believed to be less effective than those widely used elsewhere. China's health authority says it must maintain its zero COVID policy to save lives and to ensure the country's pandemic response is more science-based and targeted. It says while COVID-19 control in China is complex, with a notable resurgence in regional areas, the situation is generally under control.